To me, it was a very democratic process where every one of us involved had an input.
I've got a lot of health issues anyway, so it felt like if I would be helping to define where things were going wrong and maybe help correct that, and that felt like that would be a worthwhile thing to do.
It was really good because there was a load of us and we're all coming at it from different angles and different health issues.
I would say coming up with the questions themselves, that kind of stuck in my mind. Around the table in the Grand Hotel, eating rhubarb and custard, shortbread. Yeah, the way we came up with the questions, that was the most interesting thing.
Rhubarb shortbread? What? Wait a minute. We're getting ahead of ourselves already. Rewind. In this final episode of our 3-part series about a research project on health and digital inequalities, we're going to talk about how we did this research, the methods we used, and what we learned in the process. So far, in the first 2 episodes, we've talked a lot about the findings, what came out of the research. But in this episode, we're going back in time to reflect on how we put this project together in the first place.
We knew how important it was to understand the perspectives of people who might be shut out by the increased use of data-driven systems. So much of health is physical and embodied in people, in local communities, in buildings, in systems. And so really understanding how people experience the physical community aspects of health is just as important as understanding the more technical aspects of it as well.
That's Aidan Pepin, who was then a senior researcher at the Ada Lovelace Institute, specializing in public engagement research.
Public engagement research is similar to traditional methods of understanding people's attitudes, like using focus groups or polling, but it's more participatory. So it's about, rather than just going and asking people for their opinions and their thoughts, sort of extracting data or insights. Public engagement and participatory research is much more about letting people speak for themselves and articulate their own research conclusions. It's about letting them have more involvement in the research process, potentially, thinking about how the research is designed, how it's conducted.
Okay, so just a reminder, in case you haven't heard either of the other episodes in this series, I'm Kira Allman, and I joined the public engagement team at the Ada Lovelace Institute when we were working on a project in partnership with the Health Foundation, looking at data-driven systems and health inequalities. Aidan and I worked together to come up with the design of the public engagement research part of this project, along with Rima Patel, who was then an associate director at the Ada Lovelace Institute. The earlier phase of the project consisted of a public attitudes survey and desk research, coupled with interviews of tech developers, designers, and managers. This part was supposed to be about bringing in qualitative, meaning descriptive, interview or discussion and dialogue-based insights from people's lived experiences. I'm an anthropologist, so, of course, I suggested doing some kind of ethnographic research. Hold up, ethnographic research? Let's refer to the research dictionary for a sec.
Ethnography is a research method that anthropologists use a lot. It can take many different forms, but it pretty much always involves spending time with people in their ordinary lives, observing how they live. It could be how they work, play, socialize, practice their faith, cook food, learn a language, or pretty much anything that makes us human. It also involves talking with people, both in informal ways and in formal interviews, usually long ones, where there are some specific things the researcher wants to ask about. I could go on.
Yeah, it's a whole thing. But let's leave it there for now, Research Dictionary. For this project, the thing was, there was no clear specific group or community to focus on. Data-driven systems, basically all digital systems in use in healthcare, are everywhere, impacting everyone. And the Ada Lovelace Institute hadn't used this particular method in-house before.
The peer ethnography approach that we developed was novel for Ada Lovelace Institute and novel actually for me. And I think I was just so excited because I just thought it was brilliant. It was ambitious in all the right ways. I was really kind of excited about the idea of it, but I have to admit I was a little bit daunted by the practicalities of it.
Now, in the planning phase of the project, we got some good, challenging feedback from our advisory board. folks with wide-ranging expertise in healthcare, digital and data-driven systems, and social inequalities. They asked, have you considered getting patients directly involved in designing or conducting the research? And we said, well, now we will. It was a great idea, inspired by a kind of public engagement that has become much more common in health research in the UK than probably any other research field. It's called PPIE. Take it away, Research Dictionary.
PPIE stands for Patient and Public Involvement and Engagement. It means that people with lived experience of a health condition or a type of health care are involved in multiple stages of the research process, not just as subjects of the research. It's research that is carried out with or by members of the public, rather than to, about, or for them. Patients and members of the public might design the research questions, or even conduct the data collection themselves.
Thanks, Research Dictionary. So, if we apply this thinking to ethnography, that involving members of the public in doing the actual research is important, we get to something like peer ethnography, where peers, meaning members of the community we want to study or work with, co-design and co-conduct the research. And that's why we teamed up with
Brian Scott,
Stephen Porter,
Karina, people call me Kai, Karina or Kai's fine,
Caroline,
and
Tracy.
They're peer researchers, and they come from the Apple Collective. Here's Tracy, a different Tracy, an Apple Collective coordinator.
The Apple Collective started a number of years ago, and it was born from a little initiative called Poverty to Solutions, which was 3 groups, ATD Fourth World, Dole Animators and Thrive Teesside. And we knew we needed a larger membership and a more geographical spread. So we started some conversations with other groups, particularly Expert Citizens at the time. And then Scotland Poverty Truth Community came on board, RAPAR and a number of others. And what we want is to give an authentic voice to people who live in very difficult circumstances. But we wanted to come together and have a mandate to take action and have an ability to collaborate. And we knew across the country, not just in England, but in Scotland as well, people were facing the same issues and didn't have a united voice. So we wanted to create unity and solidarity. And so hence Apple was born. We take charge of our own agenda, what's important to us and what issues we want to address. And in particular lately it's been the digital divide, and that stemmed from the COVID, the pandemic, that sort of heightened it and brought it to the fore. And that's where we were born, and now it's just onwards, upwards and growing our membership.
Now, it's worth saying that there are many different groups affected by data-driven systems and health inequalities. The Apple Collective members who were peer researchers in this project all have lived experience of poverty, and they're all living with or close to someone living with a long-term health condition. They also come from different places across the UK. But there's little ethnic diversity among the peer researchers and the interviewees. We know this is a serious limitation and gap in the data. So this research, actually like a lot of ethnographic research, isn't representative. It can't be. It's specific to the lived experience of these researchers and our interviewees. But focusing on the experiences of a specific group or community can still be valuable. It helps reveal how inequalities manifest in everyday life for people facing intersecting forms of exclusion and marginalization, and how those inequalities are shaped by locality and community dynamics. So after all that, several rounds of research design, feedback, and consultation with community groups that led us to the Apple Collective, we were finally ready to get started. Yep, we've reached the beginning.
I'm always anxious. What if they don't want to engage? What if they don't like how we're doing this? I guess my anxieties were even higher than perhaps usual, because we were asking people not just to be participants in workshops or dialogues, but to be researchers in their own right. And so the stakes were slightly higher in terms of how much they had to be involved.
Brian, Coy, Caroline, Steve, Tracy, and another peer researcher you won't hear in this podcast, Rosie, pitched in from the beginning to help define the topics we would explore in interviews, to develop the questionnaire they used, and to refine the process for getting interviewee consent. We did all this in a series of in-person and online workshops. And we got off to an eventful start. when the venue we were supposed to meet at in York, caught fire.
Morning. There has been a fire incident in one of the buildings near York CVS, so all meetings will be cancelled for today. Please cancel with your attendees and do not turn up to York CVS. Sorry for any inconvenience. Kind regards.
Aidan, Laura, another researcher from Ada, and I were all en route to York. I took a screenshot of the email and sent it to Aidan. Hi, Aidan. Sorry to message you on here, but thought I might catch you faster. Bad news. This is Kira, by the way.
Oh no, what a nightmare. We'll get to York in 20 min. Give me a call if you need. I'll do some Googling for alternative venues.
Thank you. We'll update you when I know more too. My train is delayed, lol. So I'll get there around when you do. Someone from Apple Collective is from York, so he's helping as well to find somewhere. Well, our hero from the Apple Collective found us a space at what we can only assume is one of York's fanciest hotels. In a conference room kitted out with an espresso machine, notepads and pens, and little cellophane-wrapped parcels containing rhubarb and custard shortbread.
We all sit round the table in the Grand Hotel, eating rhubarb and custard shortbread.
Yeah, the change of venue could have easily stolen the day, but we still got some research done.
Yeah, the way we came up with the questions, that was the most interesting thing.
In a flurry of Post-it notes and assorted sweets, we developed the themes of the research, which you can hear a lot more about in episodes 1 and 2 in this series. We wound up focusing on the aspects of data-driven healthcare that people encounter most in their everyday lives. Things like booking GP appointments, ordering prescriptions, and getting lab results.
It was brilliant working with the peer researchers. They were all so engaged and so dedicated and brought their own mark and stamp to the research. I loved that, and I loved those workshops.
Over the course of 6 workshops and various conversations with peer researchers in between, we developed research questions and an interview questionnaire. The peer researchers conducted interviews in their communities, Ada Lovelace Institute researchers analyzed the interviews for themes, and all together we evaluated and reflected on the findings.
I think it went really well. I was nervous to start with because I hadn't actually done interviews at that point. That was my first experience of being on that side of the microphone.
We learned a lot as professional researchers working with peer researchers.
When we got the interview transcripts back, I was just so blown away by the quality of what we got back in terms of the depth of insight that I don't think you'd have got if you just put a professional researcher into an environment and asked people to speak. A lot of people opened up and talked about things in a way that they may have only done with another member of their own community, and it was probably quite far from what we first imagined when we started the project, because it was richer than what we could have imagined.
Before I'd done this with Ada, I probably would have said to people, do it if you want to, but probably not really encouraged it as much as I would now. It's definitely changed my outlook. More people with lived experience do need not just research, just having the voice heard in all different areas is key, isn't it, to change, I think.
This method, working with people with lived experience, brings something important to the research: specialized insight, a kind of expertise unattainable through study or professional practice.
You can say it in layman's terms for somebody. I think that's why you have to have people with lived experiences involved in research. Overall, it was great, and it was comfortable settings, having a cup of tea or a cake. And I think if you can make the person feel more at ease, then, they're more likely to open up.
And perhaps, just as importantly, the value of this kind of research is in the experience of doing it as well. Taking a method that's all about listening and using it to really listen, blurring the lines between research subject and researcher, and challenging the inequalities of those roles in the process.
The actual process of conducting interviews is easy. Listening to the stories and trying not to get too involved in them was harder. It's a sense of anger and outrage. Most of the interviews were known to me, if not personally, through acquaintances and things. So you try not to let your righteous indignation get ahead of you.
Most of the people I did interview, I knew. It was an uncomfortable environment that we were doing the interviews in. We just treated it as though we were just having a chat. I'd just go down the questions, and half the time you'd ask one question and they'd go off on a tangent, and they basically answered about 6 or 7 questions.
As professional researchers, we've felt the value of this research.
My name is Mavis Machirori. I am a researcher at the Ada Lovelace Institute. The value of having peer researchers was just being able to get the words that come with the emotion that people are experiencing on their everyday lives. There was no cherry picking of, let me try and find something that will, tug at the heartstrings. People just said what they were living through every day. And you could tell it was every day. Nobody was trying to one up on the other person. This was a group of researchers who really wanted to bring the voices of their families, their friends, their communities into this space of policy where very often they're not brought in.
I'm Anna Studman. I'm a senior researcher at the Ada Lovelace Institute. Having peer researchers work on this project was so valuable because the trust and the shared context that peer researchers have with their interviewees is the reason that we got such rich insights and such valuable reflections and perspectives on people's experiences with something that might in many ways be uncomfortable to talk about or an area where they've had bad experiences.
My name is Aidan Pepin, and while I was at the Ada Lovelace Institute, I was the public participation and research lead. Something I loved when I was listening back to the transcripts was you could hear the individual styles of the peer researchers and how they interviewed. You could kind of almost hear, this was a discussion among friends over the kitchen table, and actually what better environment to hear how people really think and feel about a complex issue than over the kitchen table with a cup of tea and amongst 2 friends.
And the peer researchers have felt the value of it too.
I think I'd sum up in empathy. The people who are taking part in the research, who you're asking questions of, they feel more comfortable with you. You're not judging. You've been there, done it, bought the T-shirt, so to speak.
I think having somebody with lived experience, when we go to interview the people, we know what kind of questions to lead them in, how to explain it better to them.
You show empathy yourself, they're showing empathy to you as well. So it's more like a conversation than it is research. And that's really how you get good research, by doing that.
Obviously, you have to merge those experiences and expertise to have better outcomes. You can't just do it alone. That's my experience. I think you need to bring a whole mix to the table to come up with the solutions. No one experience has all the answers.
They were so grateful to actually have their voices heard. I got the feeling that the anger, the upset they felt, either they were treated accessing primary care services or their family members were treated accessing primary care services, the fact that they were able to get their voices heard was important to them.
When we talk about research having an impact, that's impact. This project made us think about how the process of research can impact people's lives as much as or in different ways than the products of research. It doesn't mean all research needs to or can be done this way, with members of the public working as researchers. But it does point clearly, powerfully, toward the value of including lived experience expertise in research design. It's also worth addressing a few practical questions you might have listening to this podcast. We paid the researchers for their time, attending workshops and conducting research, and we covered or reimbursed travel expenses. We provided recording equipment and training in how to use it. No research project and no research method is perfect, and ours aren't either. But research is about sharing what you learned and learning from it. We're still doing that. If you want to read more about this project, visit adalovelace.org, where you'll find the report Access Denied, which summarizes findings from this lived experience research and delves into some more detail on the methodology. This research was part of a larger project conducted by the Ada Lovelace Institute in partnership with the Health Foundation. This podcast was recorded and produced by Cherry Soup Productions for the Ada Lovelace Institute. Cherry Soup Productions are Kira Allman and Connor Malloy. They recorded the interviews, wrote the scripts, produced the podcasts, and composed the music. Thank you to Ed Allman, yes, that's my dad, for being a great research dictionary, and to Mavis Machirori, Anna Studman, and Aidan Pepin for providing recorded reflections on the project, and to the peer researchers, of course, for all their work making this happen and for their interviews in this podcast.